Hi, welcome everybody to the IDRPP's Assistive Technology Solutions Echo. We're thrilled to have you join us for this new series running through Assistive Technology Solutions. My name is Janelle Preston, and I am the project coordinator here over Echo. If you will take a minute and put your name and contact information into the chat. We are recording today's session. We record every Echo session. It is stored on our Canvas pages as well as our YouTube channels. We use that for quality and educational improvement, as well as the opportunity for you all to go back and review it. If you're like my brain, sometimes it takes me a while to really listen and hear that information, and so I go back and review them several times. If you don't wish to be recorded, you can just disconnect from the session. If you've never joined an Echo session, again, welcome to your first Echoes. Echoes are amazing because you get to learn from everybody on this call. Everybody on this call has great insights and thoughts and resources that we're not all aware of. And so it's really that interactive community. If you have any questions, put those into chat. At the end of the presentation, we will leave some time for Q&A. The other great thing about an Echo is we have the opportunity to bring a case that we work with and, again, get great information on a case from everybody on the call. I am the lucky one today that is presenting my case, and I can't wait to get all the recommendations and resources that are happening from all of you guys to take back to this family that I work with. But as we are talking about individuals, clients, families, anybody that we're working with, please remember to protect the individual privacy. So try to avoid or just de-identify any of that information. If you have any questions about that, you can reach out to one of our amazing hub members on this team. They all have an asterisk in front of their name so that they're easier to find in chat. Key components of an Echo session is that we do have a presentation. So today we are hearing from Bora and Dan Crowley, who run the Utah Assistive Technology Program. And then we have a case presentation, as well as in that case presentation, we get all of your feedback. We compile those and put those onto our Canvas page for anybody to utilize. We have been on Zoom for a while, and so we hopefully know how to rename our profile, but here are some instructions. We'd love it if you would turn on your camera. Again, if we were in person, we'd all be looking at each other, and it just makes it easier throughout this virtual world. Raising your hand, or you can do some reactions. Again, if you have any questions about that, reach out to Leo. He is just a genius on this, and so we'll be able to help you do that. Just some basic Echo session etiquette. So please respect the presenter. Use the chat or raise your hand to ask that question. Keep those questions brief and on topic. We want to get to know everybody on this call, so if you would do a brief introduction of yourself and who you are, where your organization is before asking that question. Again, it just helps create some of that kind of networking that happens in person and trying to replicate it here in that virtual world. We love to have your cameras on. It makes it easier as a presenter if we're seeing faces versus just blank screens, but we do know that it's during lunchtime. So if you're busy eating lunch, that's just fine. In order to get a credit of attendance, we ask that you fill out a survey. Throughout today's session, Leo is dropping in the survey link as well as the PowerPoint presentation. in chat. And so the survey link is how we then send out a credit for attendance, a certificate. And we love those surveys. The surveys are what we take back to our funders to show all the work that is happening through these ECHO sessions. We have a Canvas page where we store the recordings, PowerPoints, any handouts that we receive, as well as the compiled recommendations for the case. So you can always email projectecho@usu.edu and we will get you access to the Canvas page. Just another plug for those case studies. That's a great way to get information from all of the colleagues on the team to share that. Sometimes, you know, when we're out here, especially I think about that in early intervention, I'm out here doing that work all here by myself, and that's not really true. So I love when I can brainstorm and problem solve solutions to the families that I work with. And then we also do have social media that we share information about upcoming sessions, resources that are shared with us, and other useful tools. So if you want to take a minute to follow us, and then I'm going to stop sharing and turn the time over to Bora and Dan, who are going to be our presenters today.
Thank you. All right. Well, good afternoon and Happy New Year. Thank you again for taking time to be here today. And I appreciate the opportunity to share information about assistive technology and how it is supported at both the federal and state levels. My name is Bora Lee, and I serve as the director of the Utah Assistive Technology Program, or UATP. Dan, would you like to introduce yourself?
Finding the mute button. Dan Crowley, I'm Assistive Technology Professional, Rehabilitation Engineering Technologist. I work as the Northern Utah Coordinator here for the program.
Thank you, Dan. So whether you work in healthcare, education, aging services, workforce development, or community programs, assistive technology is already intersecting with your system and sometimes without you even realizing it, right? So today's presentation is intended to do two things. First, I'll provide an overview of the Assistive Technology Act, the federal law that authorizes and funds assistive technology programs nationwide. And then Dan is going to take over to explain how that federal framework is implemented in Utah through UATP. So as we move through the slides, I encourage you to think about assistive technology not just as devices or equipment, but as tools that support daily activities, independence, safety, productivity, and participation across lifespan. The Assistive Technology Act, often referred to as the AT Act, is a federal law that was first enacted in 1988 and has been reauthorized several times, most recently as the 21st Century Assistive Technology Act. The continued reauthorization of this law reflects a long-standing national commitment to ensuring that assistive technology remains available, relevant, and responsive as technology and service system evolve. So under this law, federal funds are distributed through formula grants to all 50 states, 4 U.S. territories, and District of Columbia and Puerto Rico. And each state is responsible for operating a statewide assistive technology program. So this is really, rather than focusing on a single service, the law requires states to implement a continuum of activities which allow individuals, families, professionals to learn about assistive technology options, compare different solutions, and make informed decisions before purchasing or adopting technology. Next slide, please. So to understand why the AT Act exists, it's helpful to define assistive technology in practical terms. Assistive technology, AT, includes any item, device, or system that helps a person perform tasks that might otherwise be difficult or impossible. So this may involve mobility, communication, vision, hearing, cognition, self-care, or interaction with the environment. AT is not limited to medical equipment. It is not only for people with severe, profound disabilities. It also includes everyday tools that support daily functioning. AT supports participation in education, employment, healthcare, independent living, and community activities. In many situations, the right technology can reduce risk, increase efficiency, and support consistency in daily routines. So historically, many people face challenges identifying appropriate technology, understanding available options, or determining whether a device will work in their specific setting. And of course, the cost and uncertainty were often major barriers for consumers. So therefore, the AT Act was designed to address these challenges by creating a structured, statewide approach to information, hands-on trials, and technical assistance so people are not making decisions without adequate support. So one of the strengths of the AT Act is its national consistency paired with state-level flexibility. So funding under Section 4 supports assistive technology programs in every state and territory. Each program operates statewide under a federally approved plan and is required to report activities and outcomes annually. At the federal level, the AT Act is administered through the Administration for Community Living, often referred to as ACL. Standardized reporting allows federal partners and policymakers to understand how these funds are used and what outcomes are achieved across the country. And at the same time, states have flexibility to design service delivery models that reflect local geography, population distribution, and infrastructure. For example, states with larger rural areas, such as Utah, we must address travel distance and service reach differently than more densely populated states. So this structure allows programs to remain accountable while adapting to changing needs and conditions. And then you can find more information on this AT3 website. You can click on different states and how they do different, provide different services. So this slide summarizes the core state level activities required under the AT Act. These are the services people actually experience. And this is where the law becomes real. These are not optional activities. Every AT Act program in the country is required to provide these services. The first two, device demonstrations and device loans, they are closely connected and they are both written directly into the federal statute. Their purpose is simple, but very powerful, right? This is to help people explore different options, test different solutions, and make decisions based on real experience rather than guesswork. So for device demonstration, this is the try before you buy opportunity. People can see different options side by side. They can compare different features, ask questions, and get practical guidance. This is important because assistive technology is not one size fits all. What works for one person may not work for another. Demonstration reduce uncertainty and help people identify solutions that actually fit their daily routines. And device loan allows people to borrow equipment for short periods of time and try it in their own environment, either at home, at work, school, classroom, during recovery. And this is critical because a device that looks great in a clinic, so when you come into a lab and you try out, but it may look different in real life. So loan programs support trials, temporary needs, evaluation before long-term decisions are made. The third is device reuse. This refers to providing refurbished assistive technology at low or no cost. This is important also for two reasons. First, affordability. Second, it keeps high quality equipment in circulation rather than sitting unused. So, of course, this is practical, efficient way to expand access while making responsible use of resources. And finally, state financing activities or the alternate financing program, AFP. The AT Act allows states to operate or support financing options such as low interest loans and small grants that's specific to Utah. So these tools exist because cost is often one of the biggest barriers. Financing provides a pathway forward when insurance is delayed, coverage is limited, or no other funding source is available. So if you take one thing from this slide, these activities move people from I've heard about a device, I've seen that device, to I've tried it, I understand it, and I have a realistic way to get it. So this is really the practical intent of the AT Act. Next slide, please. And this section shifts from direct service to what the AT Act defines as state leadership activities. So these are required activities that strengthen how AT is understood, implemented, and supported across the state. When we talk about leadership in the AT Act, we're referring to statewide activities such as training, technical assistance, information referral, and public awareness. Functions that build statewide capacity and support coordination among partners rather than internal program administration. So training and technical assistance focuses on building knowledge and skills for individuals, professionals, and service system. Access to device alone is not enough. Successful use often depends on proper instruction, follow-up, and practical guidance. Training helps ensure AT is used effectively and integrated into daily routines. For public information and referral, this provides clear guidance on AT options, available services, and funding pathways. Because the system includes multiple programs, rules, and timelines, this helps reduce confusion and direct people to the appropriate resource more efficiently. Public awareness is about increasing understanding of AT across communities and service systems. This matters because many people don't realize AT exists beyond most common examples, or they may not connect their daily challenges with a technology solution. So awareness helps people recognize opportunities earlier before a situation becomes a crisis. And finally, system collaboration. This is where AT Act program work with education, healthcare, employment, aging, community partners. This is important also because people don't live in one system at a time. Collaboration helps improve coordination, reduce duplication, and expand consistent access to information and service statewide. So these leadership activities make the entire AT ecosystem work better so that AT is not only available, but also understandable, usable, and supported through the networks people already rely on. Next slide, please. Another defining feature of the AT Act is its broad service population. AT Act programs serve people of all ages with any type of disability or functional limitation, including chronic health conditions and age-related changes. Services are also available to family members, caregivers, educators, clinicians, and other professionals who support individuals using or exploring AT. So for most services, there are no restrictive eligibility requirements tied to diagnosis or income. The focus is on functional needs, daily tasks, and individual goals. So this approach allows programs to respond flexibly as needs change over time. Next slide, please. Okay. Assistive technology includes a wide range of tools, from simple, low technology solutions to advanced digital systems. As technology continues to evolve, what qualifies as AT also evolves. The AT Act definition is intentionally broad to accommodate innovation. So while mobility devices like walkers, wheelchairs, rollators are commonly recognized, AT also includes communication devices, adaptive tools for daily living, and technology that supports memory, organization, and task completion. Many AT solutions now incorporate smart home features, voice control, alternative computer access, supporting safety, efficiency, and independence in daily routines. So these guiding principle is that ATs should be selected based on how well it fits a person's environment, activities, and preferences, not solely on diagnosis or funding source. And can you please go to the next slide? So UATP, this brings us to UATP, Utah's Designated AT Act program, and I would now hand it off to Dan.
Thank you, Bora. That was great. Covered a lot of ground there. Hopefully give everyone a good feel of what it is as a 10,000-foot viewpoint, what we're trying to accomplish here. I'm going to try and get through a little bit of more of the nitty-gritty for those here in Utah. So for those that are reaching and on this call or on this meeting from outside the state, at this point, some of the nitty-gritty won't apply directly to you, but this will be an example. If you haven't already been in touch with your state's AT program, they'll have similar things. So you see a lot of parallels with what I explained today. The first thing to share on this slide that we're seeing right here is I'm up here in Logan. We have another office down in Salt Lake. They're in the same building as UCAT, for those that also know UCAT. And then we also have an Eastern office. And then starting this last year, we have established a traveling van that makes routes through Southern Utah. That's been a great blessing for everyone involved. It allows us to collaborate and coordinate. Now, as you can see, the state's pretty big, and I'm saying we have 4 offices. So are we doing everything ourselves? No way. The only reason that all of this works is because we're doing this in collaboration with a lot of the other state AT programs or other paralleling programs that work with this population that we serve, right? So thank you. Let's see. I forget it likes to do this way. Okay. I'm going to dive a little bit into our, actually, I forgot. I want to stop sharing this. Oh, I didn't want to stop sharing my screen. I just want to stop sharing my presentation. Okay. There we go. I am going to move us over for a second here to our website. However, I have a bad feeling that you're not actually seeing my website. Let me stop that and reshare that to make sure it's actually sharing.
We were seeing your website.
Oh, okay. All right. There's usually a little green halo that appears around my window, and that wasn't showing up. So I've had a bad feeling. I've presented other times about halfway through. They say, we're not seeing the same thing you are. Okay. Very, very often, I will get voicemails and emails that are all centering around the same question, which is, how do I get started? I've heard about this. I saw it at a booth. I saw it at an ECHO presentation, but how do I get in touch with you, or where do I go? We have really worked very hard to make our website very user-friendly for the general public. Okay, so I really hope for anyone that's on here, most of your questions will be answered on this website, and we've tried to make it pretty streamlined. On our homepage here, we just have a basic introduction about who we are. We have a financing tab here. It goes over the loans and the details on that, as well as small grants and the criteria for that in great detail. And then it also has the contact information for the person that you'll need to get in touch with in our program. Again, about 95% of your questions will be answered here. And if they're not, there's a nice link to who in our program can answer that question. So that's a great resource for any financing questions you have there. One thing that we haven't mentioned super strong at this point, but I will mention, it's not as popularly used of a service. We do also provide loans, micro loans for people with disabilities that are entrepreneurs and starting businesses. So, and that website explains that. Here under our services tab, Bora talked about demonstrations. So that is our lending library. So it's a library full of AT, and the details about that are listed right here. Okay. And then here in our next couple tabs, it goes over our reuse services. But a good chunk of our services, as you look on this page for demonstrations, we manage these services. If you want to find an item, whether it's used or whether it's new from the lending library, through this database called AT for All. And we've been trying to make more and more people aware of this website. It's one of the strongest ties that we have to all the different programs across the state for connecting people who need assistive technology to where the assistive technology is, whether it's at our library or whether it's at some of the other AT libraries that are stashed throughout the state. So just a simple walkthrough here is that you can look for items. Okay, this is all without even creating an account. And so these items will be listed, but say you are not in northern Utah and you want to look for something maybe farther south, right? Or you want to look for something around Salt Lake, or you want to look for something at a particular program. You can pull up that program specific library, right? And that's a great way to get you equipment items that are a lot closer to where you're at. And the, I was meaning this one, the type of AT, a lot of the used equipment that I see at my office is centered around mobility. Insurance funds mobility very strongly, so therefore I get a lot of donations around mobility. But as far as assistive technology goes, there are all the different areas of assistive technology that someone would need. I would actually say this last year, maybe year and a half, assistive technology about recreation, we've actually significantly increased, and we've also trying to strengthen our network in the state in that particular area. But in any of these things, we try to provide resources, either ourselves or other programs that can offer that. Once you do create an account, you can request an item through this website, and whoever is the manager of that equipment will get a notification saying that you're requesting it. I'll go ahead and log in real quick. Another feature that I want to share here is that anyone, whether you for the individual you're working with, or you just direct the individual to do it themselves, once they have an account created, they can say something they're looking for that they want. So they can create an item that they want. And then what's nice about that is, for me, whenever I go and look at this item list, I can actually see what it is other people are wanting, and I can try and connect them. So sometimes even if you don't know where the item is, just have the person post a wanted item ad, and then the rest of the people that are also looking on this website will be able to find that, and we'll be able to go from there. So that's what I wanted to share about AT for All. Here we have our cost of services laid out. That's another big question. So we have that listed there. Mostly it's just the pricing for the used equipment and the repairs. We have for our library, it is free to loan things out. If people are loaning things out generally in a short-term nature because it's for recovery from surgery or something like that, we do have a small charge for that, just because over time those ones do get worn out. We need to recoup some of that cost to keep the library going. Our locations are listed here along with contact information on how to find us. A lot of the information that can be helpful about our program, AT for All details on that, as well as just some kind of compilations of helpful information we have listed in this. And then obviously you can find our contact information for all of us there. I'm going to go back to our slide right now. Boom. So I know that was a lot over our website and everything else, but now with that in mind, I'll explain some of these things here. So whenever we talk about reuse, repair, Bora explained used equipment, we're getting it in. The other component of that we are doing is some of the equipment that we get donated is not in very good working order. It's never in working order when it gets donated. And we go through and fix it up and make sure it is working order before people are purchasing it or borrowing it. But other times it's not salvageable. It's just too far gone, right? And we take that equipment and we part it out. We pull everything off of it that's useful. We use that for repairing equipment, but additionally, we have a lot of parts on hand that then can be used for custom projects. So professionals will come to us and say, hey, do you have this? Is there any company out there in the world that invents something for someone like this? And for short-armed, two-fingered people, there isn't, right? Meaning there isn't companies that can develop products for such a minute population size, right? And so we have our shops and we have all these parts, and we can often invent and create the things that they need. So that's another thing to mention when we're talking about reuse. As I teased a little bit before, we have our lab on wheels, and this is, I know, a van, and you can see it in the bottom right there, but I've done my best to try and shove my shop into that van. So it's got a welder, it's got all sorts of tools in there. And then we, on our website, have an easy request the van to stop by your place. A little form you can fill out. And then by doing that, we can pick up and drop off equipment to you. So it's helpful for people in the rural areas as well. I should have remembered my slides. I forgot I have a specific one for custom fabrication. Bora was smiling at me. We do a lot of 3D printing, and then because I'm on the main USU campus, I also have access to all the fabrication facilities on here. It is a lot of fun. Do not ask me, don't send me an email that says, this is the item we want, can you make it cheaper? That's not custom. That's just, you're just asking me to make it cheaper because I'm not going to charge you as much. If the product exists, I'm going to direct you to our lending library so you can borrow it, right? If it doesn't exist, it's a unique need, I'm absolutely happy and thrilled, and we do it every single day where we build unique and custom solutions for people. And they take all sorts of different designs and varied. And one great benefit of being up here at the USU campus is I can often leverage student classes that are needing projects to fulfill their educational goals. As far as getting out and about in the community, we try to set up booths, different outreach events. We are happy to come and do a presentation at a senior center or at any other type of event. We can do that in person or virtual. The more information we receive about the population, we can try and tailor those devices. There's no way we can always bring everything in our library. We can always just bring a handful, right? So if you are reaching out to us about that, give us a feel for who's coming, and we'll try and bring AT devices that would be interesting to that particular population. We recognize that as someone is walking through at a fair, it's not in that moment that they're needing it, but we hope that it sticks so that later on as they're interacting with someone else, a family member maybe, that they might be able to think back to that moment and say, hey, I remember they said something about this. As far as our loan program, we do reduced interest loans. So that just means that whatever the going interest rate is for loans, if you are already planning to purchase a piece of assistive technology, and generally it's a higher priced item, common items for this are vehicle conversions, hearing aids, things that aren't traditionally covered by insurance or other standard funding routes, but are essential and critical. And so therefore, you're just going to take out a loan to purchase that item. If you partner with us as you're going through that and you meet the criteria, then whatever the going interest rate is, we can reduce that. We kind of buy off the points to start with. As far as who qualifies, all the details of that are listed again on the website. And we are happy to say that we are one of the states that we have, as listed right here, we're 150%. We've really tried to make it much easier and not too much of a burden for people to be able to meet that. So we're happy and pleased with that, and pleased with the grant board for making that possible. Okay, so just in a little bit of a conclusion, I know that was a bit of a fire hydrant and a lot of things going on there, but something to kind of roll around in your mind, what might prompt you to reach out, right? About 25% of the population needs these items. As far as some of the assistive technology, I would say it's it's crucial for independence, but other times it's actually almost falling into a medical route or a medical necessity, right? In that without this, they will end up going to the emergency room, right? And that's where we're really trying to avoid people in that situation, and we're really trying to be supportive. And often the speed at which we can provide a service, as opposed to trying to go through insurance or other routes, makes it to where professionals in the community will come and reach out to us first, because whenever people don't have the equipment they need, it can turn sometimes quickly into emergency situation, and they can come and get same-day service through working with us. So that's sometimes a benefit, I will state, of our program that you can utilize. As far as our seniors, we want to help them be able to stay in their own place as long as they can, and but they're often very resistant to change. And so family members that can be thinking of that and trying to help them stay in, be the ones to reach out, try and get that family member to try new stuff. And I found that to be very important, that demonstration. It isn't until that parent is hands-on using it that they finally say, oh, hey, that's kind of handy. And no amount of talking by the children will ever get them to adopt it. And then, like Bora mentioned before, there isn't red tape around a particular diagnosis. It's just if you have a need, if you can benefit, if you have a functional limitation and can utilize us, utilize us. This graphic is we're kind of leveraging it from our national kind of the umbrella that we're under that helps manage some of the stuff. And this is a nice graphic that gives you an idea of the hand-holding that we're taking someone through. So whenever people first reach out to us, whether it's an email or a phone call or just walking in the door, sometimes they're just asking a question and we can answer that question, redirect them to another program that provides it. Or, sometimes I just get an email that someone says, this is a client, this are limitations. Do you know anything about this? And I say, oh yeah, here's these 3 products. Just a response to an email. And they say, great, thanks, that's all I need, right? So that's free, doesn't cost anything, and often saves you a lot of time, as it's, my job to try and stay up on the market. Okay, if we aren't really sure just based on a YouTube video if that's a good fit, then we're looking at trialing something from the library, right? And then if we want to try it at the home, then we're borrowing that thing home for a little bit so we can make sure it works at home. And then if we're like, yeah, we really like it, if they say we don't like it, that's fine. Just return it back and we'll start working with you. But if we say we like it, then we'll start working with them through the process of how are they purchasing it, whether that's, through their insurance or whether that's maybe they're looking at a used piece of equipment, right? It doesn't matter to us. Ultimately, we want clients to get the best possible need. So usually if someone comes in with insurance, I am pushing them towards that because that comes with guarantees and warranties and the latest and greatest. So we're definitely striving for that. And then depending upon their situation, then we might be looking at some financing to help them if traditional routes aren't helping us out there. Okay, so speed rushing through this, I tend to be long-winded. Here's our website. We do try to keep stories on here about things that we have done in the past. Sometimes as you're looking through that can prompt you to think, oh, I didn't know that they could do something like that. Oh, I should reach out about, something similar, right? And then we have obviously our outreach. Then we have our lending library here, which is, I believe this is linking. Yeah, that's linking right to the AT for All website I showed you, where you can find things both from us and for other partners throughout the state. And that is what I have to share with everyone today. Appreciate everyone's patience as I stumbled around Zoom here a little bit. Love to have Bora share any other thoughts and then any questions that everyone has.
Thank you, Dan. That's great information. And you've done such a great job explaining all the things that we do. I just wanted to add one thing with the fabrication that Dan mentioned. We actually have an Instructable where you could also build your own equipment. So there is a link in the chat box. Dan, do you want to explain more about Instructable, how it works?
Yeah, so there's a nice website, not just put on by us, but it's just out there in general for anyone who makes anything. It's kind of just a fun website that you can search for any of your hobbies, and chances are someone has a hobby like you and provides some free plans to make something like that, right? If we make something that's custom, and as we're making it, we're thinking, you know what, this isn't just a one-off. Like, there's probably other people out there that could benefit from something like this. Then we'll go ahead and make plans. We'll take pictures. We'll try to document some things about it. And then we post these plans here. These are free. You can go on, you can download. And so we're trying to just continue to compile this repository of different ideas that we've developed for different individuals over the years. And this is just a continuing to grow repository here. I would say probably the most recent one that I did is we had someone who was in a wheelchair that did irrigation, and we were able to help them build a custom irrigation gate that could raise and lower that gate that was fairly affordable. And they really appreciated it and thought, you know, that's not the only person in a wheelchair that's doing irrigation out here. We're in Utah. We got a lot of farmers. So that is instructable. So that's a great place to look. Thanks, Bora, for remembering that.
Thank you, Dan.
Okay, any questions that we have from the chat? I've been keeping track of it.
I'm not seeing any questions, so.
Yes, so if there are any questions, you can raise your hand, come off mute, or put it into chat.
I'll ask a quick question, honestly, because I kind of
Okay.
forgot. Because I think that you guys mentioned that you're under a federal umbrella, correct?
Yes.
So then how does like funding work necessarily? Like, is it just kind of more grants based or is it something
So it
different?
is formula based. So there's a pot of money that is distributed across the 56 AT Act programs around the nation. So that's how we get the funding.
Oh, okay. And then are you guys kind of like the central AT program in Utah, would you say? Or are there
Yeah.
kind of other program? Okay. Okay.
So we are the AT Act program for Utah. And then
Okay.
there will be another 55 of us.
Thank you.
But as I
But
said, those
okay.
are requirements that we must provide these services. However, how they operate, it will vary depending on where you are, because depending on your staff capacity, ours is very decentralized. We have Salt Lake City, Logan, and Vernal, and our mobile traveling van. But other states, they could be just one location that manages all. So depending where you are, it looks very different state to state.
Oh, okay, that's interesting. Thank you.
Pretty much every state AT Act program, though, will be working in coordination with whatever state program's already there. And in every state, you're going to have the independent living centers, right? So we collaborate with them a lot. Here in the state of Utah, we have UCAT. We're very grateful for them. The UAT teams, the DSBVI, Sanderson Center, right? We're working with the network, right? And there are some things that we offer directly, as we are the one that are kind of the best at that service, right? And there are other things that we say, no, actually, or not, and we'll direct you to that person that is, right? So we don't need to be the one that does it hands-on. We do a fair amount hands-on, but we definitely don't do it all. And there's a lot of programs that we're partnering and working with here. Utah Parent Center does a fantastic job of helping people be aware of the resources, not just ours, but most all of them around the state. So yeah, it's definitely a collaboration. Good question.
Yeah, and for ATI programs where they are housed, so the lead agency could be different. Ours is housed at Utah State University, so there will be university-based organizations. There could be nonprofit standalone setting that you can be housed at, or the state entity government, where like some states would have be housed at VR or other setting that manages statewide activities, but the governor actually designate where we would be. So now we are a state university. but it could be different down the road. But we love being housed at Utah State University, and it's just a great way to collaborate with other projects and services. And definitely we cannot do this alone, and we see a lot of partners that have joined. So I really appreciate and continue support from you.
That's
Thank you.
awesome. Thank you, guys. I like hearing about all the collaborations that you guys have. I think it's interesting how agencies can just kind of uplift each other.
Mhm.
Janelle, if there's any other questions, let's take them. But if not, I think let's go ahead and move on to the case study. I think if after the end of the case study, if there's any more questions that might spin out of that, we can take them at the end.
Okay. So I get to be the one who presents our case today. I'm really excited, like I said, to hear everything you guys have to say. My name is Janelle Preston, and in my other hat and other world, I work as a Part C provider in Northern Utah here in our up to 3 early intervention program. I've worked in Part C for about 20 years as an autism specialist. So I am bringing you guys this information about my cute little Finn. He's 24 months old. He came to our program he was a transfer to our program, so he came from another program. And when I first met him, Mom listed off all of these diagnoses that went on, and so he was eligible for Part C based on the one I have on the screen. He is an only child. His aunt watches him during the day while his parents are at work. He receives a lot of outpatient therapy on top of early intervention. So he sees a physical therapist, an occupational therapist, and a speech language pathologist at outpatient. And then within early intervention, he receives ABC services, which are our autism specific services. He also has an OT, an occupational therapist, and a physical therapist. On top of this, he comes to our ABC class with his aunt that helps work on some of those skills and areas that impact kids with autism. So when we were at our last visit, Mom and Dad were talking to me about that he's just using a single gesture for communication. And one of their biggest things is they want him to be able to interact with peers or with others outside. So their biggest area of concern is really to support his mobility and communication when he's out in the community. So Mom was talking to me about when he was on his gate walker and they're at the grocery store. He just looks at anybody who walks by, and he's just such a cute kid, and so people will want to say hi to him, but he has no way of saying hi. So we were brainstorming different ways to utilize a switch on his gate walker in order to increase that communication when he's out there. So his goals that he has is to increase that mobility by crawling 6 to 8 feet, participate in playtime by completing some fine motor tasks, and then imitating or initiating communication by asking for items. Some of the things that we have done, like I mentioned, he does use a gate walker. And then at my last visit, he actually took a few crawling things. And it was really exciting because he's not done that even at his physical therapy appointments. So we were thrilled with that. I just introduced some communication switches with the family. And he is also using pictures during snack time. The newest thing, and I don't know how it is working, I contacted Dan at UATP and said, Dan, I have this gate walker. Here's my idea. How do I connect something to it? And so Dan crafted a device that hooks to his gate walker that we put the switch in, and so that when he's out in the community, he can say hi or how are you to others. So I'm really excited to go back and see how that works. When I was talking to the family, and as I think about this little kiddo and his family, these are some of the community discussions I'd love to have your guys' input on. Is he does use a gate walker and switches, and so I'd love to know what are some creative strategies that could be used to motivate his mobility, and ideas for motivating crawling to play with his peers. He doesn't really like peers. He really is more of an independent player. Likes to play on his own. Some other ideas, the other question is fine motor activities when he has that limited attention span. And then what are some other devices that should be introduced to the family in early intervention, and ideas for adaptive toys? So Leo has assigned us all to breakout questions, and hopefully has sent in chat what question you are taking. Is that correct, Leo? Did you send that out in chat? Okay. So if you'll just take a minute and introduce yourselves, and then we'll talk about these questions and then come back as a main group. Everybody should see their breakout groups. All right. And do we have everybody back, Leo? All right, Kurt, does your group want to go over one or two ideas?
Yeah, I actually took the notes, so let me pull them up quick here again. We talked about fine motor activities, and I think the overall theme of that was to have a variety of things, figure out what they love, and try to help them be able to play with that. We talked about different bins with different textures and see what textures they enjoyed the most, and use that to have them reach in and grab toys out or that sort of thing. We also talked about other assistive technology they might want to be introduced to. Some of them were switches on toys, using similar switches to continue to get used to that switch, and then putting it across different toys, and then also using different switches on the same toy so that they can get the idea of what a switch does. The other thing we talked about is mobility and making sure that their desires and their family's desires are met, that if they really want to focus on walking, let's focus on walking and put them in a gait trainer. If they want to focus on being able to be with peers, maybe we look at some powered mobility or that, so they can keep up better with peers, so they get that social interaction. We also talked about frame running. It's a newer to Utah thing where you get in a device and it's not powered, but it is a lot faster than in most cases than traditional walkers. And so maybe you can get them staying with their peers, but not having to use powered mobility if parents are averse to that. So
great. And then it looks like Bora stepped away, and she was our note taker. Oh, there she is back. Okay. I was going to do some recall, but Bora took our notes. So Bora, do you want to share one or two ideas from our group?
Yeah, I think Kurt mentioned a lot of it, but we wanted to find out what the kiddo likes first, right? And then talk to parents about adding things such as small basket to the gate walker trainer, so that he can carry pretend fake eyes and perform deliveries as a mobility task. Because Janelle, you mentioned that he loves the kitchen set, so we kind of have that idea, and also the ice. Other thing, we kind of tied into the language aspect, the literacy-based activities, creating maybe a tape, like Christmas tree surface with the tape, and for the toddler to place pom-poms, so that fine motor skill building is there. And then also share reading, adding manipulative and AAC to increase engagement and enable children to like choose different pages and use different page turners, so that the kid can read or increase the literacy skills.
Great.
More?
No, that's good.
Okay.
So then if you will all send those notes to projectecho@usu.edu. We compile all of the recommendations, send it out to whoever did the case presentation, but also store all of those recommendations on our Canvas page. So if you ever have a family or a client that you're working with that you're like, ooh, somebody gave that recommendation, they're available also for anybody to utilize with that. Our next ECHO session is going to be February 3rd, and we are having Lisa Gomez from the Utah Parent Center talking to us about increasing that advocacy for assistive technology. So make sure to join us next month on that, and then also complete our survey so we can make any changes or provide any feedback. So thank you all for joining. Enjoy the rest of your afternoon, and we'll see you next month.